So moving on, the next question, we have a question that says, my uncle who has never smoked has had a persistent cough for weeks and recently started coughing up blood. He also lost weight without trying. Could this be lung cancer? What test should he get?
That's a very good question. And in India, where the TB incidence is very high, if a patient who's not a smoker is coming to me as a physician and is having the symptoms described, coughing, coughing up blood, especially, and is losing weight, TB would be my number one differential. But lung cancer would not be far behind. Lung cancer would also be very high on the differential. Smoking is the most common promoter of lung cancer. It is the biggest risk factor for lung cancer. That does not mean all lung cancer patients have to have smoked in their life. That is because we have enough environmental exposures, especially given the high ppm pollution in major cities, that our risk of developing lung disease and lung cancer is very high. Even if we don't realize it, there are other factors as well which can contribute to your cancer risk, not just smoking. So absolutely, if somebody is losing weight, is coughing, and even if they're not coughing up blood like this patient, it needs to be investigated. And weight loss is one of the biggest alarming signs. Cancer is on the differential, absolutely. I'm sorry to say this, but TB is also on the differential. I would see either a general physician or a pulmonologist as quickly as I can. Start the workup with chest imaging and go from there. And preferably, instead of an X-ray, I would recommend a CAT scan, because when it comes to malignancy, X-ray is not really ideal to rule out malignancy or cancer.